As we're reporting today, the number of monkeypox cases in the U.S. has more than doubled in the past week to 21. Here to answer your questions is Dr. Simone Wilds, an infectious disease specialist at South Shore Health. Thanks so much for being with us.
Dr. Wilds, the CDC released some new details today about the current outbreak. What can you tell us about the patients?
Thank you for having me. A really great question. It is really important that we, as the public health, as well as clinicians, learn all we can about monkeypox so we can be informed. The classic patient and what we call the textbook patient usually presents with fevers. They have headaches, they have body aches, and then they have swollen lymph nodes. And then a few days later, they get a rash, which usually starts on their face and then spreads to the rest of the body. What the CDC has found in the 21 cases is that they have a typical presentation, meaning they don't have the classic rash that starts on the face. It's usually rash in the genital area or the anal area. Also, they found patients might not have fevers or the symptoms. I think bottom line is we just need to be aware of the textbook case and the atypical presentation so we can manage and identify these patients quickly.
Well, Dr. Wilds, as you know, the first case in this outbreak, it was identified May 17th right here in Massachusetts. So if you look at this map, health officials have now confirmed cases in 10 other states. Are you concerned at all the virus may be spreading within communities?
Yes, the medical community is very concerned about the number of cases we're seeing across the country. What I will say is that CDC has implemented certain initiatives that will help us to track, to manage, and to monitor these cases. So really a great guide to help us going forward.
All right, and the CDC now says the Massachusetts patient made 4 trips to outpatient clinics to get a diagnosis for his rash, but no one considered monkeypox until he was hospitalized. Is that part of the problem with these unusual viruses? They spread undetected because no one is looking for them.
Yeah, absolutely. That is the case. What we do find is that monkeypox can present similar to other infections, and hence that will confuse clinicians and patients alike. I think, again, it's really important that we keep talking about monkeypox, disseminating as much information to the general public so that they can be aware. The clinicians are now on heightened awareness about monkeypox so that when patients come in, we are tuned in, and so we're better able to take care of these patients quickly.
Okay, Dr. Simone Wilds from South Shore Health, thanks so much as always. And a note to our viewers as well, if you have COVID-related questions that you'd like our experts to answer, just email them to ask@wcvb.com.